The sternoclavicular joint is the main axis of rotation for movements of the clavicle and scapula. There are three ligaments to consider: the anterior, posterior, and inferior sternoclavicular ligament, the interclavicular ligament running between the clavicles, and the costoclavicular ligament that runs between the clavicle and the rib. When we're talking about sternoclavicular joint injuries, there are three injury types: a sprain, a dislocation, or a fracture. When we talk about dislocations, the anterior dislocation is going to be the most common. The posterior dislocation is less common than the anterior due to the fact that you have a stronger posterior sternoclavicular ligament, and the forces usually favor an anterior displacement. However, if there is a posterior dislocation, it can be life-threatening due to the close proximity to the trachea and the neurovascular bundle. The third type of dislocation is a superior dislocation. Mechanism of injuries may be indirect or direct. An indirect mechanism would be a longitudinal force that is applied through the clavicle to the sternoclavicular joint. A direct force would be one that is on the clavicle at that joint itself. Signs and symptoms will include localized edema, deformity if it's a severe sprain or dislocation, pain over the medial third of the clavicle. It tends to be localized to involved ligaments at the SC joint. In the case of a posterior dislocation, the trachea may actually shift left or right, resulting in a feeling as if something is stuck in the throat. The person will have limited overhand movements, and a long-term disability could result in scapular dyskinesis. For range of motion, you will see reduced active and passive range of motion for shoulder abduction and flexion. Special tests that will be performed include the Hopkins crossover test, which includes passively flexing the shoulder to 90 degrees and horizontally adducting it. You can also perform a sternoclavicular joint stress test. In this test, you place one hand on the proximal end of the patient's clavicle and the other hand on the spine of the scapula. You want to apply gentle inferior and posterior pressure on the clavicle and note any movement in the SC joint. In the case of a posterior dislocation, you will want to test cranial nerves if the patient has diminished pulse, dizziness, or nausea. Okay, I want you to raise your eyebrows. Okay, relax. I want you to follow my finger. Okay, just look straight ahead. Can you hear this?
Yep. Yep.
Okay. Let me just pretend you're smelling something. Okay. Stick your tongue out. Say ah. Okay. Clench your jaw. Smile. Swallow. Alright, don't let me push you down. Shrug your shoulders. Relax. Okay, shut your eyes. Feel this?
Mm-hmm.
Feel this?
Mm-hmm.
Okay. I want you to stand up. I want you to shut your eyes. Put your arms out to the side. Relax. An X-ray will be performed to rule out fractures, and the treatment will depend upon the actual pathology. If the SC joint is dislocated, there will be a closed reduction with a posterior lateral force on the shoulder. Treatment will generally be conservative with a sling immobilization if possible, but there may be a surgical repair to the joint, especially if the person has had recurrent sternoclavicular joint sprains.